So, so we're talking about hospital stays today. So I'll talk for a little bit and then we'll have time for questions and answers. So what I'm going to tell you is um, things that I've experienced and have found useful over the years. Um, so a lot of times when people go into the hospital, they've never been there or they've never had a loved one there. And so it's all new. And we don't know our rights, what to expect. Um, and I remember when I first started helping, like with my grandparents in my mid 20s, and I remember just being completely at the doctors. I was just looking to the doctors for all the answers, and I thought they were giving me all the information so I could make choices. And what I realized is that I was just getting a slice of the information, and I wanted all my choices so I could make empowered decisions that were right for me or my loved ones. So I'm going to give you some information that you won't hear from the doctors, most likely. It's sort of like behind the scenes, and so you have things in your back pocket that will help you to navigate not only your own hospitalization if that happens, but also for a loved one. So we'll start off with before the hospitalization. So we've had workshops here and that are recorded and available about important documents to have before you get hospitalized. So those are important. So that means durable power of attorney for healthcare. So if someone ends up in the hospital and they're not able to speak for themselves or they want an advocate, that document establishes someone as your agent to speak for you, and also with confidentiality laws that it allows the doctors to know who to talk to. So you'll want to have those filled out ideally. Also important is a medication list and a contact list. Also, um, I'm not going to go into everything in detail, but those are on recordings from the past, and you can look at all the emergency file that you need to go to the hospital. So those are the top things that you'll want to have prepared already. Now, sometimes it's an emergency and you go in and you don't have those things prepared. It's fine. It's just that would be best in an ideal world. It'll make things easy for you and your loved one. So before hospitalization, what I find myself doing for myself or for my friends or for people that are on my radar, I have just learned to observe if there's any changes in their behaviors. So this could be I'm visiting a loved one and I see that maybe their speech is a little slurred. Maybe their walking is not quite like normal. Maybe they're limping. Maybe they're a little walking a little slower. Maybe their foot is dragging. Things like that. Just a little bit different. Any little thing. So what I find is that noticing the little things and tracking them, writing them down is very important, because you may think, oh, that's just, maybe they're just having a bad day. Maybe they just woke up. Maybe they need to sleep, like all those things. That may be true. But sometimes if you pay attention to the little things, and maybe it's three little things add up to one big thing, you can prevent something from happening or know something needs to be addressed. So those are prevention, which we'll talk about later, / beforehand. The reason those things are important to track is if someone does go into the hospital, that you can have the information for the doctor so they can help put the pieces together. So it's very helpful. So if you can imagine, if someone comes in to the hospital, they're in the emergency room, they are just a blank slate. The doctors do not know them. The nurses do not know them. They just see whatever the person is presenting right then. They don't know what they were like yesterday or a week ago. So if you give them the information, like these symptoms started about 5 weeks ago, I noticed these things. They happen to start a new medication around the same time. Uh, they happen to, so you get the picture. If you can give the hospital staff a full picture of the situation, that really helps them be able to determine how to help the person. Um, well, a story just came up, so I'll tell you now. I was thinking, is this good now or later? Could be either one. So I'll tell it now. Um, so a close family member, we'll just call them, name unknown, anonymous, um, deals with multiple chronic health conditions. And she started to be more tired than usual. She was sleeping. She was having trouble getting up, very lethargic. Her oxygen saturation was dropping. Um, she was sleeping more, and she couldn't figure out what was going on. And so we all kind of started thinking, what could it be? And she got to the point that she needed to go to the hospital. She did not want an ambulance call. She did not want us to call 911, even though she could barely get herself out of the chair. So we got her into the car, took her to the ER. She stayed there all day, of course, like you do, 7, 8 hours in the ER. And this is even a healthcare system that has electronic medical records. So they had her medications. Luckily, they had it on their file, because it goes to any hospital and any doctor in their system, which is not typical. And they had her power of attorney on file. So they had the documents. But she came in as this blank slate, and the doctors looked at her medical conditions and they thought, well, maybe it's regarding her lungs. So then they started checking out her lungs. They couldn't find anything. And then they started checking out her heart, and they couldn't find anything. They discharged her, and this is weeks and weeks of following up with specialists. We'll go down the lung specialist test area. We go down all these conditions. Maybe it's the arthritis. Maybe it's the cancer treatment she just stopped. So there was a lot of things to check out. Then there was another emergency room visit because she was so tired, which resulted in a couple days stay at the hospital. Still, they didn't figure out what was going on. We all thought, this is just it. She's going to be dying soon, because she couldn't even get up. So she came home from the hospital. She got on oxygen. She just wasn't doing well. She was spending most of her time in bed. So I kept looking. And I looked back at the medical records. And right around the time her symptoms started, she had started a new medication for arthritis. And I look up the side effects for that particular medication, and it's like she's got all of them going on. So we tracked down one of her doctors, who checked with a doctor on call. Can we stop this medication and see what happens? Like some medications, if you stop it, you don't want to stop it right away. It's gradual. So like, okay, stop it, but you may not see effects for a couple weeks. So she stopped this medication. Within a week, she was 50% better. Within a couple weeks, she was all the way back to her baseline. So all of this was only because of a medication she started. And she went to the hospital 3 times, twice for emergency room, one admitted. And none of the doctors, even though they had all her medical records, it was never detected that it was because of this medication. So you see, we were tracking it. We kind of found out what was happening to begin with. We were trying to give the doctors the information. So that's the end of my story. But this will be highlighted as we go along here as the importance of this. And especially the medication piece is important. A lot of times from hospital discharges or even starting new medications, it can be the cause for hospitalizations. So what are the top reasons that older people are admitted to the hospital. So oftentimes it's chronic medical conditions, like the story I just told you. This person has arthritis and heart disease and past history of cancer. Um, so multiple things going on at once. Sometimes it's infections. Sometimes it's urinary tract infections, especially with older women. They tend to be more prone to urinary tract infections, which can look like a sudden onset of dementia. Uh, Also, dehydration is a top reason that people end up in the hospital, which also could look like dementia. So that's another reason to give the hospital staff the full picture of what's going on with the loved one. So if they show up that looks like dementia, hey, their memory, they don't have any short-term memory, they're confused. And if you tell them they were fine last week versus, yeah, for the last couple of years, their memory has been declining. Those two are very different. So they can look at the dehydration or the infection for the confusion versus an ongoing dementia. Uh, Falls is a big reason for hospitalizations. And sometimes sometimes older people will fall, especially women, because they've got more osteoporosis. It's always a question, did they fall and break something, like fall and break a hip, or did they break a hip and then fall? So sometimes it's, you'll hear people say, well, mom broke her hip and she fell and broke her hip. And then that was, the end. She didn't live past a year from that. Well, sometimes people's bones get so, so much osteoporosis that they break and then they fall. And then, their body was really getting towards the end of its life and its capacity. So it wasn't necessarily because of the fall. Cardiovascular disease, strokes, medication related, just like my story told you, medication related issues is a big reason for hospitalization. Dehydration and dementia are big reasons also. And also like end stage cancer related challenges is also a big reason why people are hospitalized. So if people have those type of conditions, it may be that your observation skills and paying attention to how they're doing increases because they have maybe a history of some of those things, and you think, I'm going to start paying attention when I visit them. And then when you pay attention to it, you could bring it, if they're open to it, you could bring it to their attention. And see, sometimes what's nice is that when you find things early, if someone's starting to be confused, for example, and you think, they're having some symptoms that it's not quite like normal, you might just encourage them, like, are you drinking enough water? A lot of times it's as simple as that. Or have you started anything, have you started a new medication? So then people can avoid the hospital and they can participate in preventative things, or maybe it's time to see their doctor. Okay, so someone goes to the hospital, they bring their documents with them, they have their power of attorney and their medications, hopefully. So while you're at the hospital, what do you do? So you know that your current doctor, if you do have a doctor, your doctor does not automatically or pretty much ever follow you to the hospital. Usually your primary care physician doesn't even know you're in the hospital. Sometimes people think, oh yeah, Dr. Smith, he knows I'm here and he's probably going to even come visit me. We've had this relationship for years. The way our current medical system is in the United States is the people at the hospital, the hospitalists, the specialists there, are the ones who will treat you, diagnose, and discharge you, all without talking with your doctor. A lot of times your doctor might not even have privileges at the hospital, so they can't really even talk to your doctor. So Once in a while, I've seen doctors, maybe they have privileges at that hospital that they maybe do some shifts there, and then they can find out you're there if you call their office. So that could potentially happen, but I don't typically see that. It won't be till after discharge, till they say follow up with your physician or your specialist, that you'll get your physician involved again. So again, you go in there and you're a blank slate, and they're just trying to put a band-aid on and get you back to your normal life. um, it's important to get to know your discharge planner. The discharge planner, there's everybody that's admitted to the hospital has a discharge planner. They're usually a social worker or a nurse, and they are the intermediary between you and the hospital or the doctors. So as soon as someone is admitted to the hospital, they're assigned a discharge planner, and they start planning for the discharge immediately. Um, Oftentimes, you won't really know their plan. They are not usually the hospital and the doctors aren't great at communicating what they're finding, what they're going to suggest, what the plan is. You're just kind of laying there waiting for them. So, um, in that vein, the doctors usually do rounds early in the morning. So if you want to talk to a doctor or get information, be there early. And sometimes they just kind of peek their head in. Um, Sometimes they'll chat with you for a little bit. Uh, but if you or an advocate want to get information, I would show up early to talk to the doctors, get to know your discharge planner. Sometimes, oftentimes, it'll be like 2 in the afternoon, and they'll tell you, "Okay, you're being discharged today." And like it's often a panic situation because you don't know what the plan is, you don't know what rehab looks like. Say if you have a broken hip, for example, and you need physical therapy, and you might need caregiving at home or grab bars, things like that. Um, they will often say at the last minute, "Okay, you're ready for discharge," and it'll be like, "Well, wait, how am I going to handle all these things, these new needs that I have when I'm discharged?" So if you start talking and making friends with the discharge planner early, then you can let them know like what your home situation is, where you want to go when you're discharged, and also that they know you're interested in working with them towards the discharge, or else it might just come out of the blue. So get to know your discharge planner. I would definitely suggest having an advocate. Like if you're the one in the hospital, have an advocate there, either there for you. If you can have a friend, a caregiver, somebody at the hospital with you as often as possible. Like if you had someone just sitting next to you 24/7, that would be ideal. If not, just someone there as much as possible, or even someone that's available on the phone would be like next in line. But definitely have an advocate, because if you're in the hospital, you're not going to be feeling like yourself. I mean, even if you go to a doctor's office, it's good to bring someone with you because we often don't remember everything the doctor says. Uh, it's a little bit overwhelming. So write things down, have an advocate, um, and so they can help you because you're not thinking clearly, most likely, that they can help you with the plans. They can help you talk to the doctors. They can just help think through things. The doctor's saying this. Does that seem like a good idea? Or what do you think? These are my options. Help me think it through. So you don't have to be all on your own with that. An important thing to remember is if you're on Medicare. So usually people, if they're over 65, they're on Medicare. If you're in the hospital and the doctor says, or the discharge planner says, you're ready for discharge. If you don't feel like you are ready, like you don't have all your questions answered, your health is still not like, it might not be a baseline, but you're moving in the right direction, right? They've got your problems kind of figured out and you're on a path towards health. If you think, I'm not ready yet, you can what's called appeal the discharge. And for each state in the United States, Medicare has a quality improvement organization that's assigned to that state. So that's a Googleable thing. who's the quality control uh, organization for Medicare for California or whatever state you're in. And that's simply a phone call to them. And you can say, I want to appeal the discharge. And they ask you questions about where the person is, what hospital, etc. Oftentimes, if you just tell the staff there, I'm going to be appealing the discharge, they usually don't want to go through that process of appeal because they've got to get all your medical records together, send it to this organization, and then an outside doctor looks at it and decides, yes, they're ready or no, they're not ready. Oftentimes, if you just say, I want to appeal the discharge, that puts the brakes on, and it might buy you an extra day or two of them just going, okay, let's think about things and let them know why you're going to appeal, what your concerns are. But that is a great ticket to have, to know about. It can definitely slow down those really fast discharges that sometimes happen. Okay, so I guess lastly, for while you're in the hospital, know that most people, when they're in the hospital, they will be laying in bed for 85% of the time. You probably won't be able to get up to go to the bathroom. They probably don't want you to. Um, the idea is nobody wants you to fall. So if you're in bed, you're less likely to fall. But you also, the muscles can, you lose muscle strength during that time. So it's hard, but just know that that's going to be typical. And then if you need physical therapy, usually they come once a day, maybe for like 30 minutes. But besides that, uh, people are in bed. Same thing if you go to a nursing home, you're in bed. And if you push your call button, they might be there in a little while. Again, that's if you have an advocate for you, they can go track people down to help you out. So, all right. So the discharge plan. So the discharge planner will help you with their job is for you to have a safe discharge. And what does that mean? So they don't want you just to, be on the street. They don't want you to go home and not have the support that you need. They don't want you back in the hospital. It used to be a little different, but now with the changes, which are great, if you go back in the hospital for the same thing you came in for originally, within 30 days, the hospital doesn't get paid for it. So they have more of an incentive that they want to have a safe discharge. They want you to go home at least for a little while before you come back. So what happens usually is if you have something that needs rehab, like if you need physical therapy, occupational therapy, maybe you need some IV antibiotics. Our healthcare system right now is set up that someone stays at least 3 days in the hospital, and then they are discharged to a skilled nursing home, sometimes called a rehab. And that happens because sometimes you need it, but secondly, because that's what insurance pays for. Medicare pays for after 3 days in a hospital, they'll pay for a nursing home. And that can be up to like 100 days in a nursing home. Sometimes you're just there for like a week or 2 or 3, depends on what you need. And there are limit to maximum days. But the important thing is to know that when they suggest a nursing home, which happens 95% of the time, that almost never, I'll say rarely, does someone actually need to go into the nursing home, especially if they have the funds to be at home. Maybe they need some caregiving. But if you have a friend, a partner at home, you probably have a caregiver that can do what they're going to do in the nursing home. And Medicare will pay for physical therapy, occupational therapy in your home. It's called home health care. So the doctors at the hospital, the nurses will suggest a nursing home for physical therapy. What's going to happen is you're going to be in bed for 85% of the day and get maybe an hour of physical therapy, maybe 4 times a week. And besides that, they're going to be laying in bed. So that's a if you learn one thing from today, it's like you have options when you're being discharged from the hospital, unless it's like a tracheotomy or a trach that that needs to be handled at a skilled nursing. Um, I mean, most things can be handled at home or in assisted living. So you have choices. But I mean, I can't tell you almost every time, probably every time, but almost every time they say I have a client or a family member that's being discharged from the hospital, and they say, okay, they're going to skilled nursing. Because all that is a phone call from the discharge planner to the nursing home going, can you take this person that's got this going on? They say yes, and they ship them over there. If they're going home, it's more work for them to set up the supports. And most people are just trained. It's just the way our society is set up with our healthcare, that they just offer what insurance will cover. So no, if you have some funds, it's not necessarily always expensive, or the support at home, that you have options, that these things that they're saying you need to go to nursing home can be done at home. And also, I've heard sometimes that the doctors will be kind of threatening to say, like, well, you can't go home, or I'll let you go home if you have 24-hour care and this and that, physical therapy every day. Well, they can say that, but they don't have the power to make you do that. So it's a mix of finding out what is it that you need, what is the care that you need to get better and to rehab, and can that be provided at home or in assisted living, wherever your home is. Because a nursing home, you're going to be share a bed. It's loud. It's not the usually the best environment to heal at. So you have options. Sometimes people need to go to nursing homes, but you do have options, and that's really what I want to let you know. And lastly, when you get discharged, pay really close attention to the medications that you're taking. Sometimes in the hospital, they'll start new medications or stop medications, and then you get home and you're like, well, do I add this to what I used to take? Do I take only those new ones? So it can be confusing. And that is one of the reasons people end up back in the nursing home or in the hospital. So pay close attention to the medications and just run that by either the doctors at the hospital or your primary care physician, and make sure the list of medications that you're taking are actually what you're supposed to be taking. That I find that especially true with people with blood pressure medications. Sometimes someone's been on a blood pressure medication for a long time and no one has told them to stop it. Or some medications are like, well, your blood pressure is over this, take this. If it's under this, take this. And they just start taking everything, no matter what their blood pressure is. So just be real clear on the medications you're taking and when you're supposed to take them. Finally, we'll just talk about preventing a hospital stay. So like I talked about, observing and tracking is really important. Sometimes things can be prevented if you can just tell what's happening a little bit earlier. Stay hydrated is very important for all of us. As we age, usually we need more light around the house. So falls can be sometimes prevented if you have night lights around the house. I have lots of things I can trip over here, like dogs. And so I have night lights all over, and I even bring them when I travel, just to be safe. Physical activity, walking, doing your exercises, things like that is very helpful. Social support. So sometimes as we age, get more isolated, but social support is really important, and it definitely helps decrease hospitalizations. I think that's what I will say about prevention. So that was a lot of information. So that's the end of my info part of it. I would love to open the floor if you guys have questions, comments, anything like that. Just raise your hand. Thanks for hanging in with me for the information part. Peggy.
Hi, Cheryl, could you elaborate a little bit on the part of, being taken care of by a hospitalist and that your doctor, doesn't come in? I just want to share an experience I had, and I've had several of these. I was in the hospital for AFib, very, obviously suddenly. And I couldn't understand why they didn't call my cardiologist, when I got there. And I've had this kind of experience, several times. And to me, it's like, I guess the way my logical brain thinks is like, wouldn't it just be more informative and efficient, especially for me as a patient, if the ER doctor would call, like in my case, my cardiologist and say, I've got this person here. This is what's going on. Is there any information you want to give me? Versus, like you say, the doctor, they just go blindly and treat what they're seeing without knowing what could be some helpful information. So could you sort of talk about why that doesn't happen?
Mm-hmm. Well, I can just say, what my experience is. I may not know everything about the real reasons. But I just know it happens. I think doctors don't have a lot of time. So it takes time especially if you have two, it's hard enough to get a hold of one doctor if you're in the hospital, for example, or even if you're not in the hospital, it's hard to get a hold of your doctor at their office. So to have two doctors contact each other, and align their schedules, I think part of it is just a time. Now you think, I think they have a lot of clients, a lot of patients to deal with in the hospital, and they just don't have time. That's what I'll say as one reason. One, then it's hard. It's hard to connect to someone, and then, like this discharging someone to a nursing home. I think part of why that happens is that it's hard. It's harder. So, with dealing with so many people in the system that we have, that I think sometimes it's just easier. I just know it happens. Now, one time I did have a client that was in, say, like a memorial system, and their cardiologist ended up to be a doctor that is in that hospital. And so they were able to participate with that person. But it's just very rare. And I don't know anything more than that. I think I think it's a time and ease, I want to say.
Yeah, it's interesting.
Yeah.
Because I often think, like, if I was a physician in an ER and someone came in that I didn't know and they were having what might be considered like acute symptoms, and I have no idea of their history,
Mm-hmm.
I would think I would want to call, their primary physician and find out, any background information. But that's just me.
It may happen, and I'm sure sometimes it does happen. It's just not typical, and I just say don't expect it. You can also always offer the doctor's name, and can you contact them? So it's just not typical. That's what I'd say.
Yeah.
All right.
What's interesting is, and this, was part of my experience, because my local hospital is West Hills. And I had to follow up post hospitalization on some treatment. And so I had to find an urgent care. And I just, by God's grace, ended up at Malibu Urgent Care. And the doctor, because their doctors there are all board certified ER doctors, so they know how to handle everything. So I get there, and the doctor treating me used to work at the West Hills ER, happened to know my cardiologist. So, you know, he was asking symptoms and everything, and, you know, trying to put together what might be happening. And he actually called my cardiologist because they know each other. And that was helpful. But I hear what you're saying. That's just a rare, you know, instance. That's not the, you know, the norm. So
it's not the norm. It may happen, and maybe in complex cases, it might be more typical if they need specific, you know, specific on a very unusual case they can't figure out. But it's not typical. You reminded me of one thing to let you know. Upon discharge, there are certain things that Medicare will cover that they may not tell you everything, but know that they, like if you need like a walking device, like if you're, I don't know, for some reason, whatever would happen, maybe you're not walking as well, they will cover like a wheelchair or a walker, but Medicare only will cover one of those things in like a given time. Maybe it's 3 years. So if you need a wheelchair and a wheelchair is a more expensive item. So choose the wheelchair, and then like just go to CVS or something, or a medical supply place, or even a thrift store has lots of old walkers. So, but they will cover that. What's another thing I want to tell you? They'll cover home health, like physical therapy, as long as you're making progress. So sometimes that's like 6 visits, 12 visits, that depends. But know that can be covered in your home. But there's certain things that could be covered, and they may not say that, but if you discuss it with the discharge planner, you may come up with ideas that if you bring it up, that they may not just tell you automatically. So always ask them, like, what kind of things do I need? Which of those does Medicare cover? Like maybe it's a shower chair. They might cover that depending on your which kind of coverage that you have and what your needs are. Susan, you have your hand up.
Oh, I'm here. I thought I was muted. I wasn't coughing all this time, was I?
No, I didn't even hear you.
I didn't either. Yeah, I have so much to say that it would take a whole thing. And unfortunately, a lot of it is negative because this system is not made to work for us. The first
you're a nurse. You're a nurse, right?
No, I'm not, but my daughter-in-law is.
Okay. Okay, gotcha.
I didn't trust that because she took over everything. But now we know each other better, and she understands me better. I've been a person who's had a tough time with medical system when I was young, so I got into the alternatives, which have worked for me for most of my 80 years. But I had 2 times when medical people saved my life, I guess. But and I'm not resistant. Well, I may be a little, but basically I'm open to just going and seeing what's up. But anyway, I have to go to doctor today, actually, follow up on stuff. It's funny. My primary, whom I picked when I had this lung operation 5 years ago, because I had an osteopath and he didn't affiliate himself with anybody. He had no hospital privileges, nothing. So I went to somebody that he knew and other people and I'd been to once before, and he's become my primary. But he's never treated me for anything. He always asks me what I want, you know, and will I have this test, that test, and shots. You know, I finally agreed to pneumonia shot because I thought that was, yeah, I'm compromised. Okay, so the most important thing I think, is that you have to advocate for yourself. You're the only one who's going to do it for you, unless you really have a very good buddy, even a medical buddy like my daughter-in-law will advocate for me somewhat now. Um, you know, you will miss stuff and you will not get what you need. They do, by the way, I've been in ER a lot in the last 3 years, and my for some reason my sons and their kids, everybody has had a brush with ER or urgent care, and so it's really amazing. I've got like a dictionary or an encyclopedia of stuff that has happened. But anyway, so what was I going to tell you? I forget things, but I've always done that. I interrupt myself and then I forget things. Done that since I was a kid. So yeah, maybe I had kid dementia all my life. But anyway, this is
So
a
what,
rough
so
time.
how, so with all this experience that you've had, like, what are the top things that you go like,
Top
hey,
things
you guys
is,
should know this?
yeah, you have to advocate for yourself.
Advocate for yourself.
And you
Definitely.
have, and also let them know how old you are, because that does matter. They will know that. At the hospital, at the ER here at the hospital, we'll get in touch with a doctor. They do that kind of automatically. So I think in every place there are different things. So don't believe everything Cheryl said, because it doesn't apply everywhere. And so
Mhm.
they did get in touch when I went in for something that was going on with my heart. It was racing and stuff. It was really different. They talked to my cardiologist almost immediately. Now, I've never been treated by him because I didn't have problems to be treated, but I have done all the tests. And he also discovered when I first went to him that I had sleep apnea that caused the problem. Okay, so just want to tell you that. Also, the ER doctors do not treat anything except maybe a break or something, or a sprain gets treated there. They send you down the hall and you go for every test they can possibly charge Medicare for, everything. So the last time I was in there, I had x-rays, CT scan, blood tests of every sort, ultrasound. I mean, it was pretty amazing. And of course, in the end, they found nothing. And and so they said it was all hypertension because I had high blood pressure when I was in there. Well, I do sometimes really get high blood pressure when I go to the hospital. It's only lately now that I'm having a little bit of a thing with it for the first time, up and down. But it's just really interesting because you're not getting care in the hospital, not in the ER situation. Even you may not even get care if you're admitted. I'm going to tell you a terrible story as quickly as I can. Well, it's not terrible. It's funny to me. Um, I went in to have a knee replacement. That was about 12 years ago. In the middle of the night, I really had to pee. Well, you can't get up from that. You have to have someone help you, or you will just tumble to the ground. I called and called and called. Nobody came. Smart ass here. I pulled my pants, my thing down, put my ass off the bed, and peed on the floor because I was not going to pee in my bed and lie in it. Yeah, I did that. I'm very creative in hospital situations.
Mhm.
Anyway, so, and then it took them at least 4 hours to mop it up. So
Mhm.
don't expect great care. That's gone. It's not in the system anymore. Um, in the nursing home I went to after the lung operation, they really screwed up a few times. The worst thing for me was the food was horrible and unedible. So they sent their little what you call the woman who had the nutritionist person, and she came up to my room and she didn't know what to say. I said, "Listen, your eggs aren't even real. You're not even giving us real eggs." So she made sure I got real eggs after that. But she really didn't get it. I said, "The food that you're giving is not edible. It's
Mhm.
not tasty, and it's not nutritious." So that was okay. So every time I go, I have to educate somebody in some way, right? Whether it's about me or something else. I don't mean to be bad, but it happens sometimes. And I think they were more careful. They certainly were more careful with me there. Also, when you leave a nursing home, make sure you have everything with you that they've given you in there, because Medicare has already paid for it. And when I left that place, they did not give me the oh, what's it called again? The breathing thing. The
Nebulizer?
nebulizer. I walked out of there and I had no idea. And I had the medication. I had a whole pile of those tubes, but no nebulizer. Well, then I got pneumonia immediately because I couldn't clear. And I stayed in and out of that for a month. I'm not doing this to just complain. I just want you to know that these things happen. And despite your best efforts, they may happen. So yeah, it's good to have good relations with the nurses if you can. They're the people who run everything, who do everything. I guess they have orderlies these days, but nurses do a lot of that too. And the doctors, well, when I had orthopedic surgery, yes, the orthopedic guy comes in. If you have other kinds of things, okay, this is the saddest part.
Okay, we're getting sort of close to the answer. If you could,
I'll just do this little story. I could talk for
okay.
now, really could, and I could answer questions. Anyway, I had the lung surgery. I was told that it was a minimally invasive surgery because they were using the machine, the Da Vinci. Well, it wasn't. It actually moves a lot of stuff around. You're having you're going through all the layers, and the bones are moving, the ribs are moving. So I've had repercussions from that for the last 5 years. I'm still not over it. And there are adhesions, there's all kinds of stuff. But meanwhile, when I was starting to have some difficulties, I called them and made an appointment. They wouldn't talk to me. And I thought that was weird and odd, and that this guy just had a big ego or something. But I've since found out something very, very different. My daughter-in-law is a critical care nurse, and she works in a hospital that's near the hospital, a little surgery. And what's happened is, after the surgery, the doctors run away and they leave everything with the nurses. And they had a couple of codings that happened a few weeks ago, and the doctors do not want to know about it. So the nurses are left to bring somebody alive, or they have to call the ER across the street. So I just want you to know that our system is pretty dang broken unless you're very rich. And you've got to really take care of yourself while you're in there. I use the opportunity anytime I go, whether it's a doctor or the ER or the full on, I plant light columns all the time. And I just sit and hold the light for everybody. I talk to the people in the waiting rooms, and I do my best to cheer them up. But when you're really, really down, like I was, so incapable of, just getting up and doing anything, you really got to just really pray and advocate for yourself and get other people to do it if possible.
Thank you, Susan.
On down.
Thank you. So what you bring up is so important. And so it makes sense when you say, like, I could talk about this for an hour, because it can be so traumatic and surprising. Like, so many things happening, like, that doesn't make sense. That was like, I waited so long, or they didn't talk to each other. I mean, we can go on and on and on. So that, I think I would summarize what you're saying is, have an advocate, be your own advocate, and have an advocate there. Also, which I didn't mention, is you can hire an advocate. For example, I'm a geriatric care manager. In the United States, there's geriatric care managers all over the place. Now, some small towns may be different. It might even be different, like, hey, sometimes I'm in a small town in Virginia, and I can call and talk to the person at the post office. Like, hey, Fanny, this is your mail delivery. Like, wow, that's really different than the big city. So everything that I'm saying is, like, it's different everywhere, but these are just ideas, and I could be wrong about a lot of things, and things change. So, Susan, what you're exclamating, you're bringing up to the surface again is it's very frustrating. And you don't have to know everything when you're in the hospital or advocating for someone else, but use your common sense. If you think this doesn't make sense, that's a good time. That's a good one. This doesn't make sense. I need some more help. What are my choices? Those are the kind of things to pay attention to. Instead of just leaving your brain at the door, bring your brain with you, and know like everybody's doing the best they can, but our system right now isn't set up that you get excellent care, no matter how much money you have. If you have more money, yes, you can hire more advocates or hire a private doctor or something, but yes, be your own advocate. And things that you think should work a certain way often don't work that way. Like, oh, we know good food is going to help you heal. But when you're in a hospital or rehab, might not be good food. A lot of sleep is good to heal, but you're in the hospital and they're waking you up 4 times a night to take your blood pressure. So it's like, sometimes it doesn't make sense. So it's another word to like, try to prevent things, try to prevent a hospital stay if possible. So stay out of there, but these are some strategies to use while you are in there for a short time. Thank you for your patience, Mariella.
Hi, Cheryl. Great seeing you, and thank you for doing this. It's lovely.
Nice to see you.
I had an experience in a hospital. I was out of the blue a few months ago with an arrhythmia, and a lot of the things that you was mentioning were really important. I find that, I am, a very sharp person. I ask questions. I ask a lot of questions, but I was very aware that I was scared because, it was related with my heart, and I have an aversion for Western medicine. I always had. I'm very holistic, and a lot of times it has been difficult for me to discern that yes, Western is very invasive and sometimes it's appropriate. So I was, blessed that I had people. I had advocates. A woman that was with me at the ranch, she was talking to the doctors, talking to my friends. And I find that it's very, it's the opposite of nurturing. First of all, it's not my country. It is my country, but I didn't grow up here. So for me, it's even more foreign, the whole thing. So it's, yeah. And I agree with you, let's do all that we can to avoid getting there. There's a little question I have is like, I found that I was one day in the hospital and I got this humongous bill, with a health insurance and all that. And I am still trying to navigate how to pay for it because, I have a high deductible, blah, blah, blah. So do you have any idea of, because I talked to my insurance, I talked to somebody high in my insurance. I don't know if they don't want to say, they gave me a bunch of numbers that don't seem to be helping. So do you know if there's any way to navigate that? To get some, I don't know if it's assistance or really they lower the rest that I have to pay because it's a big chunk.
Mm-hmm. Yeah, it's a great point. And you brought up several good points. So in navigating the bill, there are professions that help with that. One resource is what's called a claims assistance professional.
Okay.
And you can try that at the website that I found it at is claims.org.
Okay.
There's trying to think. So Medicare will have their own advocates.
I don't have Medicare. I'm not on Medicare.
Right. And then people that aren't on Medicare, I'm trying to think. I know folks on Medicare, there are a lot of times even at local senior center or the area agency on aging, they will have benefits professionals there that can help with that. For people that aren't on Medicare, I don't have a great resource. I would just say that like a benefits counselor, that's what I would start looking up. It's
Benefit
tricky.
council?
Benefits counselor, a
Counselor.
health insurance benefits counselor. There, see, our system, I don't, it's tricky because sometimes things that you get in the hospital are super expensive. Like they'll give you a couple Advil and it's like a couple $100. Like that doesn't seem right. They're used to insurance paying for things, so maybe they start running a bunch of tests instead of asking you or checking out, hey, what's it going to cost? They'll just start doing things. So sometimes you've got to be an advocate with that ahead of time, but often you can negotiate with the hospital as far as how much you're going to pay. So, and that is negotiable. It doesn't make sense, but if you call them and say, look, I don't have $30,000, I don't have $10,000 to pay for this bill. Oftentimes they'll say like, okay, they want it to be handled and they'd like to get some money and they'd like it to be done.
Right.
So sometimes you can just negotiate with them, and sometimes there's people, and I actually I don't know an exact person except for the benefits counselor, like a profession that helps with that particular thing, but there must be that. Yeah, and there might even be things that, so it sounds like you have some insurance, but it's a high deductible.
Correct.
Some people, sometimes people don't have insurance and then they end up not paying anything.
That's right.
So
I know that.
and it doesn't seem fair and all that. So I would just say that it's great that you have insurance. So hopefully they covered, some part of it. But I would try to, even before I'd negotiate, I would try to look up to see if there's people that will help you. And then you'll know like how much to negotiate for.
Yeah,
right?
but when
Can
you say
just go like half?
people
Yes.
in government organization, because I was speaking with the insurance, at a high level. I was not speaking with reps, and they told me that there was nobody that I can talk to. So how I don't know how to navigate the system. So
Yes.
yeah.
I would also look up, there's professionals. I was talking about a geriatric care manager. The organization is called Aging Life Care. Let's see what the website is. aginglifecare.org.
Okay.
And those are professionals. You could look up, and if you type in your zip code, they'll be the local people. And you could just call them. They will tell you their expertise there in the description, and some will say insurance. So I would call people in your area and they'll give you a free consultation to say, look, I'm trying to help, or trying to get someone to help me with insurance. Do you do that, or do you know anybody? And I would think after, it might take a couple of phone calls, but I think there would be someone in that organization that would be able to assist or know where you could find that. I don't know it offhand. But it is a good one. It's people need to know that. I'm sorry, I don't have a resource, but I could look it up. I would just say it is negotiable. I don't know how much. If you go like, hey, it's 50% off, you could just count on, you only have to pay 50%. That seems reasonable.
But what would you Google? That's my.
I'd say how to find care, how to find someone to help me negotiate a hospital bill. How do you negotiate
Okay.
a hospital bill?
Okay. Okay. Got it.
Yeah.
Okay. Super. Yeah. Well,
Okay, yeah,
thank you. Thank
yeah.
you for all that you're doing for us.
Sure. Thanks for joining. If I come across something, or you can also, anybody can, if you have a question like this, if you email us at serve@heartfelt.org, serve@heartfelt.org, and just say, hey, I need a resource on this. I'd be happy to look something up and see if I
Okay.
have anything, if I can come up with something, we'll email you back.
Super. Thank
Sure.
you.
You're
Much love
welcome.
to all
Thanks.
of you.
Nice to see you. Susan, do you have something real quick? We're gonna close
Yeah,
the meeting for today.
I just heard this or just read it, but I don't know what it's called, so I will find out. But there is a thing now where if you have insurance but you can't pay, and I don't know if it's in any other state besides California. There is this, I can't remember what it's called, but I will find out. Like I said, we have a
Okay.
social worker here, so I'll find out and I'll let you
Okay.
know. But there is
That's
a
great.
way of getting your bills down. And I know as far as
Yeah.
negotiating with a hospital, because I did it once, they will
Yeah.
take a whole lot less if you're kind of willing to pay it up front. If you
Yeah, and
have,
sometimes they'll put you on a payment plan. So there are options. So we'll find out. If you email us, and then we can, if you have a resource, email us. If you have a question, email us and we'll connect. Peggy?
Just for Mariella, I just Googled hospital bill negotiation services, and there's a whole bunch that came up on Google.
Thank you, Peggy.
All right. Thank you all. Really hope that helped you. Stay out of the hospital, stay healthy as you can. If not, get an advocate, and let us know
Thank you,
what you all
Cheryl.
want to talk about in the future. Have a wonderful week.
Yeah.
Thank you.
All right.
Thanks,
Thank
Cheryl.
you.
Bye.
Thanks,
Thank you,
Bye,
Cheryl.
everybody.
Thank you so much.
Bye, everybody.
Thank you. Much.